Welcome. We're just getting started. I get to watch as people virtually walk through the door, and we have 44, 51 and counting. Happy Friday, happy Memorial Day Friday. For those of you who are near a window, near UVM Medical Center at 117, you can anticipate potentially hearing F-35s do a flyby. They're actually the, what are they called? Green Mountain Boys are the F-35s out of the airport are doing a flyby to all of the Vermont medical centers today. And they finish up at UVM Medical Center at 1:17 is the time. One change from previous town halls we've had is that we are using the Q&A function today. If you look at the bottom of your screen, there's a Q&A. Just type in your question and we will do our best to respond to them. We're up to 130. Welcome to a combined faculty meeting and town hall. One thing that I miss is the opportunity to see people. I see some of our panelists here that we're able to see each other. I miss people. I assure you, life won't always be this way. And I send my regards to everybody who is out there. As we promised, we've moved these town halls to different times. I know every time is not perfect for everyone, and we'll continue to move these as we go. The faculty meeting part of this is necessary in terms of our presenting bylaws, and that's going to be a highlight for today. In addition, we're going to be talking about our strategic planning process, which most of you know has been going on for over a year. You may remember back to early group meetings, SWOT analyses, and town halls around that. And then finally, we're going to feature Senior Associate Dean Brian Cote, who's going to be talking about finances. Then we're going to open things up, as opposed to having prepared updates from those deans who are present. We're going to open things up for any brief comments, if they have any, and then open things up to questions. And we have the hour ahead of us. So with that, I'd like to welcome Associate Dean Charlie Urban. He's Associate Dean for Faculty, and he and Senior Associate Dean Krista Zala led the committee to take a look at the bylaws, which is a required and necessary part of our overall structure at the Larner College of Medicine, for two reasons. One is they need to periodically be refreshed, and the other reason is with LCME, we certainly need up-to-date bylaws that are consistent with who we are and where we're going. So with that, I'll pass things over to Dean Urban, who has already started sharing his screen. Welcome.
Thanks. Thanks, Dean Page. I appreciate it. Well, hello to everybody. What a wonderful day it is. Nice and sunny outside, and I'm going to keep this quite succinct. This is the first of 3 documents that we'll be introducing to you. The bylaws. Next will be the handbook in a few months or sooner. And then finally, the standards and guidelines. The process.
May I interrupt for 1 second,
Sure.
Charlie? I'm seeing fairly small, and I see next slide. So you may be in some presentation.
I must be. Oh dear. Okay, well that's no good. Let's try this. Is that better?
No, it was better just before for some reason.
In the upper left-hand corner, does it say you slide?
Let me try that again. This worked fine a minute ago, of course. See what happens when I do that. Nope. Close that. Let's get this thing open again. I think I know what the problem is. Whoopsie. Why isn't this thing? There we go. Let's get it over here. Try that. And that, and this. Is that better?
We're still, there we go. Thank you.
Good, thank you. I'm using two screens and I had it on the other screen. Little tip for you Zoomers. Okay. This was the process that we used to revise the bylaws. A faculty committee was appointed, and these are the members. Krista, Zaley, and myself were co-chairs, and Jan Carney was pulled in as a consultant. We began early edits in the fall of 18. We then went to COMAC in January last year and called for nominations for this committee. We started meeting May through September. We then formed a writing committee, and I'll show you why that is in a second. We took the draft, handed over to Dean Page, who reviewed and approved it, and it was recently voted on and approved by COMAC. The next two stages are a faculty vote, and I'll tell you a little bit more about that in a minute. And then off it goes to the provost and ultimately to the Board of Trustees for approval. Now, the highlights of the changes are, we made a conscious effort not to change too much. As we were reviewing it, we saw a lot of things were out of date, mostly with documents that come to us from the university. So we changed that to using a lot of links. Our editing team really got out the axe, and we shortened it down from 23 pages, which is what it is currently, to 8. For LCME, we have added a new committee, a new standing committee, the CQI committee. And finally, we put in a nice table at the end, which is also part of our LCOM DCI. And I thought what I'd do is bring up the actual document, because it's only 8 pages after all, and just kind of walk you through it, so perhaps saving you some time. So it talks about the organization, the dean and who he is responsible to, the senior associate dean and and the assistant deans, the fact that we're responsive to the dean, the secretary of the faculty. And then here's one of the first links that we've put in there. Talks about the LCOM, talks about your responsibilities and privileges as faculty. We talk about departments and how they're organized and refer to university documents. And then finally, and most of the document is about all our standing committees, our new CQI committee, admissions committee, advancement committee, committee on fitness, curriculum committee, faculty standards or promotion committee, and the nominating committee. We talk about how people get onto the committees, each one of the committees, what they do, what they're responsible for, and then the meetings of the faculty, of which this is one, and then amendments, and then when we prior revisions, and then finally is this nice table that tells you a little bit more in a nutshell about all our committees. So that's the document. You will receive in your inbox on Tuesday a ballot for you to vote on it. In the ballot will be a link to these draft, so you can study it at your leisure, as well as a link to our current bylaws, which are also available on the Faculty Affairs website. So with that, I'm finished with my presentation and hand it off.
Thank you very much, Dean Irvin. You can stop sharing your screen, please.
Oh, sorry about that.
And the highlights of this, bylaws are always very stimulating, and I appreciate the committee's efforts and due diligence. The two things I'd like to highlight that frankly I get excited about are, for one, rather than us taking the parts of the university bylaws and other regulations and taking and inserting them directly. By having a link to the university document, we don't have to do that. And what's more, if the university changes its documents, ours changes with it. So that's a real improvement.
That's a huge improvement. And you'll see those same changes in our handbook when that's done as well.
Great, thank you. The other thing I'd like to highlight is the Continuous Quality Improvement, or CQI committee, as a standing committee. This is part of our LCME process, where the LCME recognizes the importance that medical schools or colleges of medicine need to be continuously improving, as opposed to scrambling every 8 years when accreditation comes. So by having a CQI committee currently chaired by Dean Carney, and with Katie Huggett, the leader of our teaching academy, as co-chair, that's allowing us to identify issues that need improvement off cycle and continuously. So credit goes to you, Charlie, and I appreciate your putting that forward. There's a question, thanks Dr. Irvin. On Tuesday, in addition to the old and new bylaws, could we receive a summary of key changes, additions, and deletions? And I'll answer for you, Charlie. Could we put something like that together?
Well, I've taken the slide I just showed you and inserted it into the email, but the changes are so extensive in terms of shrinking it.
Major issues or changes, I think we can highlight for the readers.
I will send the same slide which highlights those changes for you.
Great. Seeing no other questions, I really want to express my appreciation to you, Charlie, and the entire committee for your diligence on this and other documents that we're working on for good overall management, but specifically in the setting of LCME preparation. The next item of business is going to feature Associate Dean Jan Carney, who's going to put forward the quite advanced draft of our strategic plan. This, I'm a big believer in strategic planning, as long as the strategic plan really leads to action. So the term strategic management is what I prefer. And likewise, it needs to be a living document that people are aware of. Strategic planning sounds like a business term, and it may have emanated from business originally, but it's a fairly simple thing. It says who you are, what you care about, where you're going, and how you're going to get there. And the first part, the who you are and what you care about, is really important. Your core values, especially. Professionalism highlighted, certainly, and as you can imagine, you'll see that featured in our strategic plan in terms of our core values. And then beyond that, the opportunity to have this be a document that really helps lead us forward. It doesn't mean you don't do other things, but it sets forth what your priorities are. I should mention that over the last year, we had a number of different events of different stakeholders, students, both graduate and medical students, staff and faculty. And credit goes to Dean Carney for shepherding this through various stages to the point where I'm proud to present it more broadly. So with that preamble, I'll turn things over to Dean Jan Carney.
Thank you, Dean Page. Let me. Okay. So I just want to talk for a few minutes about Vision 2025, a unified strategic plan for the Larner College of Medicine. And as Dean Page mentioned, we've had an extensive process. We had 8 open forums, 4 student-led forums for curriculum feedback to the Office of Medical Student Education, where we had themes from those forums incorporated, and more than 73 faculty, more than 55 staff. We had a student forum, separate student forum for graduate students and medical students that had 12 students, and 4 postdocs attended a special forum to talk about these themes for our SWOT analysis. So our process to date has been all of those scenarios, open forums, and feedback from many groups and in our community. The senior advisory group to the dean, our chairs, and our College of Medicine Advisory Council. And now we're here at our full faculty meeting today. So I understand, Dean Page, this has gone out in electronic form to the Larner College of Medicine community. So I just want to highlight a couple of themes, and people will have an opportunity to look at this, and in the coming weeks, we'll be working out some of the detailed strategies to achieve these priorities. And this will be in the form, and thank you to Ed Nort and his team about a card that is really 2 sides of 1 page, and a simple reminder to all of us about what our priorities are. So first, on one side, the vision, our mission, and our values. And I would like to read those values of professionalism, diversity, inclusion, and equity, commitment to the wellness of our students, staff, and faculty, innovation, advocacy, building on our land grant heritage, excellence in all we do, stewardship of our resources, and service to our patients, our university, and our community. And also on the first page is we're just celebrating the anniversary of our professionalism statement here at Larner College of Medicine. So that's on the first page as well. On the second page, again, based on our SWOT analysis and feedback from all of the different faculty, staff, students, and advisory groups in our college, we have strategic priorities in the area of clinical, education, research, and community, with 4 overarching objectives for each, and our strategic foundation, and I would like to read that: caring for our people, our students, faculty, and staff, commitment to a culture of continuous quality improvement, and getting the word out to the Larner community, UVM, and beyond about all the incredible work that we do. So, Dean Page, I'm going to stop my presentation at this point.
Thank you, Dean Zala. And we will be monitoring the questions or comments. We have a Q&A. We get to see any questions that are there, and we're happy to take those. This feature actually, I think, is an improvement over the email we've used before. I want to commend and thank those of you in attendance. We have set the record for attending one of these just about, I think, at 184. So I'm really delighted with the engagement and very grateful. Dean Carney, one of the things that resonates for me is that getting the word out. And do you have any comments on kind of the nature of people, and maybe New Englanders more than Texans, where I lived once, in terms of telling good things and good stories, or maybe even bragging about the things that are going on?
We're a humble community here, both our faculty and our staff and our students, and we do these amazing things, but we don't talk about them too much. And I do think that's part of our culture. So collectively, what we heard from at these different forums was, it would be good to get the word out a little bit better because of the important research, education, clinical care, service to the community, all the wonderful things we're doing. So that absolutely ended up as a strategic foundation throughout our conversations.
Yeah, there's a lot to be proud of, and not to diminish challenges we have and things we need to do to be better. But I am struck by the fact that regionally, different parts of the country are more reluctant to tell their good stories. And frankly, we can't be shy about it. Bragging about ourselves, that's another matter, but bragging about our institution, or more importantly, the people we work with, and the quality of the education, the research, and the clinical care that we can be proud of. And if we don't tell our story, then shame on us, because the story is important, and it results in, frankly, providing confidence from those who are counting on us. The other thing I'll mention is we as a group have talked about this being a living document, and what you see there, and what I just sent out with my now 12 weeks in a row weekly message to the Larner community was a PDF of the two sides of what we envision as a laminated card that would fit in a white coat pocket or whatever, just to be a reminder of our core values and our strategic management commitment. So thanks again, Dean Carney, for spearheading this. And it's something all of us own already. And I look forward to getting to a final stage. If people have further input beyond today, please let us know. And because this is not final until you all tell us it's final. So with that, I get to move on to introduce Dean Brian Cody, Senior Associate Dean for Finance and Administration. The reason I smile is because the highlight of any meeting is talking about finances, of course. But in all seriousness, we are so lucky that we have Brian Cody and his team watching the numbers for us day in, day out, year in, year out. We're obviously in a challenging environment, unlike any that we possibly could have imagined. So the news is not good about finances, but at the same time, this isn't something that we can't deal with, we can't adjust to, we can't overcome over time working together. So with that preamble, Dean Cody, let me pass things over to you, Brian. Welcome.
Thank you, Dean Page. I thought what I would do is start off with some highlights of some national surveys that have been done of four-year colleges and universities to sort of give a national perspective on where we're at. One of the key points is that we should expect upwards of a 20% reduction in enrollments at the university, potentially. The other couple points are, don't rely on deposits. Our deposits at UVM look good, but don't be tricked into thinking that all those students are going to come. The same with class enrollments. We're seeing that even though classes may be full for the fall semester, if we have a 20% drop in enrollments, there'll be significant hits to those class enrollments as well. UVM and LCOM are not immune to these significant shifts. 73% of the undergraduate population at the university is from out of state, West Coast and other areas, yet surveys indicate that students are less likely to cross state borders at this time. This is a significant impact to our undergraduate net tuition, and this is important for the LCOM, particularly for our basic science departments and the Department of Neurological Sciences, who have a heavy undergraduate teaching load. There's also the issue that we face in Vermont and all of the Northeast regarding our changing demographics. We're in an aging population. There are far less high school students that are looking to go to college, and particularly evident in the Northeast. So you combine that with the fact that we have such a large out-of-state undergraduate population, we've got some real concerns here at the university. And then the other reality is that President Garamella put forth a 0% tuition increase to try to remain affordable, and we just can't increase tuition. We're very high at this point anyway. So what are we doing to address the potential shortfall in this revenue? We have, like the university, implemented a general fund hiring freeze. We are not filling vacant positions at this point that are supported on the general funds. We are putting forth, though, positions that are supported by extramural funding or by endowments, things that we have a clear revenue stream to support. We have restricted, like the university, all funded travel. And, you know, in my opinion, I don't think we'll be seeing travel coming back in the next year. I mean, it's going to be quite slow. The senior administration of the college has agreed to some salary reductions for FY21. The dean himself is taking an 8.3% salary reduction for FY21. All the senior associate deans are taking an 8.3% reduction. All the associate deans are taking an 8.3% reduction. And all the clinical and basic science department chairs are taking an 8.3% reduction. This has resulted in us saving $500,000 of general fund salary expense for FY21. We have a target of a 5% reduction in our general fund salary expense. That target is 1.25 million. So we will be planning as well for a 10% reduction in all tuition revenue except medical student tuition. We're confident that we will be able to fill our medical school class, but from other revenue streams, other tuition revenue streams, it could be quite challenging for us. In addition to what I've just talked about, the LCOM is also sharing in the challenges that are facing our academic medical center partner and the health network. Right now, the health network is projected to be a $150 million deficit by 9/30 of 2020. Per our affiliation agreement that we have with the medical center and the health system, one of our revenue streams is based on net patient revenue, and it represents 2% of net patient revenue. Well, given the COVID-19 crisis that's happening, our net patient revenue for the health system and the medical center is off 60%. Typically, 2% of net patient revenue yields the college about $5 million. If we continue to be 60% off in net patient revenue, then we are potentially looking at a $3 million loss in that revenue stream. There may be other challenges facing our revenue streams from the academic medical center, and that really is dependent upon how fast clinical re-entry occurs and how fast patients decide to go back to the health system and the medical center. You know, and right now I've heard that the net patient revenue has bounced up a little bit and it's growing slowly, but depending on how long it lasts, we can have some significant financial impacts in those revenue streams as well. We're also doing some things specific to LCOM that I mentioned. We're not filling any general fund vacant positions. We have asked all the departments, centers, and dean's office units to take a 5% decrease in their general fund salary expense. And there may be additional steps that we will need to take as the summer months proceed. I understand, I just saw an email come through as a broadcast center email indicating that the university is looking for voluntary furloughs now from staff. So that's another step that's come out. And then in summary, I just want to share, you know, this is a difficult and challenging time for us and for all institutions of higher ed, as well as the entire country. I mean, we've never faced anything like this before. But I also wanted to share that, you know, the LCOM is about a little over 200 years old. I doubt we're going anywhere. I doubt the University of Vermont is going anywhere. We've faced challenges before. We've weathered the 2008, 2009 downturn in the stock market. And, you know, we'll get through this. We'll figure it out somehow. It will be painful, most likely, but, you know, we'll do what we need to do. Thank you, Dean Page.
Thank you, Dean Cote. And the one thing that I'll make sure is clear, and that's a really nice description of you know, what we're doing. The 8.3% is it sounds like a pretty arbitrary number. What that represents is 1 month. And what I and most of the other deans made the decision to do was after President Garamella voluntarily reduced his comp in April by in April decided not to take his April compensation. I and many of the other deans decided that we would make that commitment for fiscal year 21. And so that's where that number came from. I would also acknowledge that these cuts in the associate deans, the senior associate deans, the clinical chairs, and the basic chairs were all voluntary, which if you think about it is pretty amazing. It was unanimous. And I counted over around 25 different people who made that decision. So I think that speaks to the commitment of a leadership team that I'm tremendously proud of. The other thing I'll mention is that you said, Brian, that we have cut into the 5% that we're looking to reduce, and in that 5% reduction, what we're looking to do is, this has to do with unfilled positions as much as anything, and not looking. We weren't calculating on furloughs. I saw a question that came. It's amazing what can happen even during an event like this. Things are changing so fast, but that may play a role as well, depending on who wishes to participate. A question, and I think this reflects the issue of whether we will have a full incoming class. I can speak to the fact that I believe we will not have a problem with the incoming class, but we would, during the Q&A period, we will also be addressing that, and I'll bring on the other senior associate deans and deans and associate deans to answer any questions. What I'd like to do at this point is exactly that. Is the panelists can see the questions as they're coming up. I am going to change my view so I can see everybody here. Dr. Deschamps, I thought I saw you join us. I'd welcome you to make yourself known if you're still with us. And I knew that Claude Deschamps had a conflict, so he may have just been dropping in for that period of time. So we don't have his wisdom and insight, as he is our Senior Associate Dean for Clinical Affairs and President of the UVM Health Network Medical Group. But we're tracking the Q&A, just to remind you. There are questions there. Why don't we, at this point, Dean Zala, if you want to unmute yourself, and if there are any specific updates you'd like to provide or any further clarification in terms of how we fill our class as we go forward through the fall, in contrast to really the very complex situation on the undergraduate campus, for example, in terms of filling a freshman year class. Dean Zala?
Yeah, absolutely. Thank you, Dean Page. Medical school admissions, acceptance, and confirming their acceptance does differ from the undergraduate quite a bit. We are where we typically are at this time of year. There certainly are some deadlines and a lot of moving parts, but we're crafting our class as we speak, and accepted students do not have to confirm until July 15th, I believe it is this year. So we'll have more information about the actual class in about mid-July, but the admissions committee has reviewed, and all of the applicants and the admissions office is very comfortable with how the class is shaping up. So I would say we're at where we usually are, and mid-July is usually when we have more definitive, a more definitive cohort for the class of 2024. They were unable to hold their second or closer look day, as it's typically been called, in person. And so the admissions office pivoted very quickly and offered what they called LCOM community or L community conversations, which I think were a nice virtual opportunity for accepted students to be able to engage with different leaders. Dean Page participated, our Director of Active Learning, our student ambassadors were very involved, and that gave the accepted students an opportunity to engage with different individuals and also ask questions. So I think that was a nice opportunity that came out of not being able to offer the in-person Closer Look Day.
Great, thank you. And one thing I'll comment about what we're learning, I am learning that if you have a town hall, you actually have more people come if you do it by Zoom. Not saying we won't have in-person coming down the line, but our Closer Look Day was the most inclusive it's ever been. Not everyone has the means or the ability to come to Burlington for another visit to take another look. And this year, everyone had equivalent opportunity. I think we still will invite students back, but we're going to learn from what we've done and make sure we're fully inclusive in terms of providing students who can't come an opportunity to learn more about our college and see if this is the right fit for them after we've decided it is from our standpoint. Along that same line, if you didn't have a chance to see our Commencement 2020, I'm not calling it virtual commencement, it is the Commencement 2020. And it was likewise the most inclusive commencement we've ever had, and as well attended as certainly in my experience with 105 students. It's now on YouTube, and it's an easy find. And it's really quite heartwarming to see students in their own home hooded receive their doctoral hood by their loved ones, and actually see the joy and emotion in their eyes as they became doctors. We have a question that came up, and I'm going to ask Dean Jensen to respond to this. And it has to do with a recent announcement about suspending LCOM incentives around research productivity and what the impact might be. Dean Jensen.
Well, thank you, Dean Page. Let me start by just taking a moment to thank everyone who contributed a lab reopening safety plan. People did really a remarkable job of pulling those together in a relatively short time, and I couldn't be more proud of everyone. I would also quickly highlight that next Tuesday, 12 to 1, Chris Berger and I are having another graduate student and postdoc town hall. So those of you that are interested, please tune in for that. And I would just make one more reminder that as we move towards phase 2 of our lab reopening plan, still a little over a week away, that other key services like custodial services, supplies are also going to be ramping up slowly. So we're all going to have to be very patient about that and probably take care of a lot of routine things ourselves. But we'll work together to get there so that we can move on to phase 2 June 1st. So the question that I was asked to address is about the financial impact of closing down our research incentive program for the year. And of course, anyone that knows the history of this knows that personally, I went through an awful lot to get this program up and going. And to me, it's very painful to have to temporarily shut it down. We've been very pleased, both Dean Page and myself, with the program. Our investigators have been very pleased. So it's not a decision that we at all took lightly. But the financial impact is $1 million a year, which in the scheme of what we're facing right now is certainly significant, and why that got our attention. I would say, as we did in the announcement that went out earlier this week, that the following year, I mean, if we're back on sound financial footing, we would certainly explore restarting that program. But it has a pretty significant impact, which is why we've looked at shutting it down for this year. But thank you.
Thank you very much. The next question, I might ask Dean Zala to start, but Dean Jensen may be able to amplify or clarify, just in terms of things are changing so quickly in the state, in the university, but specifically the question is, will incoming and returning medical students, graduate students, postdocs, et cetera, be tested or undergo self-quarantine for 14 days before being allowed to return to campus? If not, why?
I'll be happy to start off with that question. I think there are a number of deans on the call that can participate. I think testing is one of the biggest questions right now, and we're working closely. I'm working with Dean Carney on this, and we're working closely with the Vermont Department of Health, as well as our state, because I think that could change sort of the landscape on returning to a particular environment. Currently, the state of Vermont, the quarantine is 14 days. The Vermont Department of Health had a slightly different recommendation of 12 days with 7 days and a test on the 7th day and remain in quarantine until the results are known. But the governor has chosen to stick with a 14-day quarantine. And our other, our affiliate partner in Connecticut is also currently at a 14-day quarantine. This has to do with if you're traveling from a state where you've spent time and stayed overnight and lived. So back and forth travel, such as for essential workers or even for our medical students to engage in clinical activities across state borders, but returning at the end of the day would not require that same quarantine. However, staying in a state for an extended period of time would. So we're operating under that current quarantine. We're in constant conversations about if that could be adjusted or changed, and if testing plays a role in that and how that would impact us. I'll stop there, and possibly Dean Carney or Dean Jensen have other comments related to that.
I might ask Dean Jensen to start, just in terms of your engagement as we're reopening the labs, and your comments about the graduate students, and then perhaps Dean Carney, if she wants to comment about that, and maybe given her role as Associate Dean for Public Health and Health Policy, whether she'd want to weigh in, because she's been in an advisory position to dignitaries throughout the state, including our President Garamella. But first, passing it off to you, Gordon.
Yes, I'll be happy to respond. I'm serving on a working group chaired by Kirk Dombrowski, the VP for Research. Beth Kirkpatrick's on that committee with me as well, to look at research and graduate programs in terms of the fall and new folks coming in. It's one of a series of working groups around the UVM Strong initiative. So we don't yet have the answers to all the questions, and of course they're very good questions. So there's a lot of discussion ongoing about testing. In the context of grad students, postdocs, we are absolutely obligated, among other obligations, to honor any of the directives coming from the state of Vermont and the governor. So indeed, if there is a 2-week quarantine for folks coming in from out of state at that time, we would certainly find a way to honor that. And certainly we will keep people apprised. If I know more by Tuesday's town hall with the grad students and postdocs, we certainly will fill you in then. My guess is we won't have a whole lot of additional information at that time. And of course, a lot of this will be impacted on how the pandemic progresses, but we'll certainly try to keep everyone informed. But thank you, Dean Page. Thank you,
Dean Jensen. Dean Carney, do you want to comment on this issue? And given the fact that there aren't a lot of questions in the queue, and since we have you here to as our local and regional and national expert, do you want to comment on the public health situation more broadly?
Yeah, thank you, Dean Page. Yes, first let me just comment on locally, and I have been either on or advising some of these committees on research and at the university level. And the most important thing I would say is people are using the science and being very, very careful. So in terms of protecting students, protecting our faculty and staff and people who are on our campus, I would say that people are looking at the right literature and thinking about this in the correct way. And having said that, you all know that things are changing very, very fast. And everyone is monitoring as the science change and there's new recommendations from CDC and elsewhere. People are following those very carefully. I do think we're extremely fortunate to have the strongest possible health department here in our state, making recommendations to protect the public. And Vermont as a whole is doing this in a way that connecting with the recommendations of the state, our university, our health network, in a very thoughtful and careful way. And again, it's being based on the science, which I think is really paramount. Looking across the country, I think that calls us into a very, very positive light. I think we're doing it right. And I would guess that some of the questions that are being asked are ones that a lot of people are asking, and that answers have not been yet determined in terms of national recommendations, as an example from the CDC, that's related to some of the testing questions. But I just wanted to reaffirm what I think is the strengths and the positive way in which we are looking at here in Vermont, and specifically at UVM.
And again, I've learned so much from you during this time. There's one question in the queue that we'll get to in a moment, but I actually want to press you, if you don't mind, on a couple things, and this wasn't scripted. Unfortunately, some issues around this pandemic have become politicized. Mm-hmm. The things that come to mind are masks and even some of the medical therapies out there. Would you comment on your perspective on masking? Because one issue that is tough is those without masks. Everybody's heard about masks. So those without masks may be trying to make a statement and may not be appreciative. They don't need a reminder, usually. They've made a decision that masks are everywhere and they're not wearing one. And how to respond to that in restaurants, supermarkets, or even our hospital front door is complicated. Would you comment on your perspective on masking?
Sure. And I think I want to distinguish between medical masks that are worn in healthcare settings, like the N95 masks, and versus cloth face coverings that have been recommended universally for all of us. And the purpose of those cloth face coverings is that when we wear them, when I go out to the grocery store and I wear one, I'm protecting the other people around me. So in addition to social distancing, we're acknowledging that some people may be able to transmit the infection without having any symptoms. They don't have any symptoms. And if we all wear masks, and the research on this is growing, that we can protect the entire community. So I would say that in terms of, no, we don't want to be confrontational with people. What I think we want to do is reinforce by our own behaviors how important this is to other people. And I do think that is definitely one of the spirits and values of our culture here in Vermont. And so the recommendation is we're all wearing them.
Great, thank you. Do you care to weigh in on the therapeutic options that are out there?
I guess let me be careful here, but I guess I think I recommend no more than 2 maximum daily doses of the news every day, and to stick to the evidence-based recommendations that are coming from our own health department, from the CDC, sometimes from the WHO. And many of us are following the literature, and some of this is coming out in a variety of medical journals. New England Journal puts out regular updates on this. Let's stick to the science. When you're talking and looking for a treatment for yourself or your family, ask your doctor and trust the people who are experts to be providing you evidence-based recommendations.
Thank you very much for a perfect answer. I can see how you were successful as commissioner of the Vermont Department of Health at one time as well, Dean Carney. And we're so fortunate to have you among us and in our leadership group. There's a question here in the queue, and it's a good question, and that is a number of working groups and committees are working on responding to this evolving situation. Would you consider including trainees or staff members in any of these groups to provide direct information on how these policies are impacting student and laboratory operations? And a number of these groups aren't being constructed by the Larner College of Medicine, I can say, and as with this meeting, for example, which is open to students and staff, and as in our work in and around our strategic plan, likewise. But I'm going to ask Dean Jensen to comment, and if we aren't taking full advantage of every voice, at least where we are setting the constituents of committees, maybe we need to, if we're missing out. Dean Jensen?
Thank you, Dean Page. All I can say is I would certainly support it. The working group that I was speaking of, chaired by the VP for Research, focusing on research and graduate studies, is coming out of Waterman. But I can certainly raise that point. Perhaps Brian might be able to comment more on this as to whether any of the UVM strong subgroups have staff or student representatives.
I can comment on my group. I'm on the Academic and Faculty Affairs working group, and we do have a student, student and staff represented on our group.
Yeah.
Gordon, this is Brian. I can also share that at least the COVID-19 Emergency Operations Group certainly had staff represented on that group, as well as students, graduate students. As far as the UVM Strong, I'm not as familiar with the committee composition, but Krista just alluded to having students and staff on that committee as well, so.
Okay. No, thank you, Brian. I will definitely follow up with Kirk Dombrowski on this issue, because I would be highly supportive of getting some additional representation on the research and graduate studies working group. But yeah, thank you for the question.
Yeah, great question, and unfortunately at times we do need a reminder that of the great benefit we have from being more inclusive and diverse and having voices that are different anytime we're trying to work through a problem and solve it or predict what's going to happen next. Here's a question that came in, and Dean Jensen, you're going to be asked this, so if you don't mind unmuting. Any idea when staff not involved in research will start returning to campus? I imagine you can refer to documents you sent out recently. But why don't you respond to this question?
Yes, good question. We've sent out pretty detailed instructions and plans that would in terms of staff coming in that are not involved in research. That is phase 3, which is June 15. So not too far away, but still a little ways. And obviously the rationale behind the cautious phased approach we're taking is just that, caution, as we roll this out. And of course it has to be aligned with the available resources in terms of supplies and custodial and everything else. And of course the underlying intent is this means that as we ramp up, if we run into a problem, we can stop where we are. If there's a surge in the pandemic, we can actually go back. But that's the rationale for the non-research staff being June 15. And of course, in the meantime, those personnel that can continue to work remotely, even in research, are encouraged to do so. So there are a number of descriptions we set out of the phased approach. If you need more information, don't hesitate to reach out to me. But thank you for the good question.
Thanks very much. Dean Irvin, I'll ask you to unmute as I read this question. I'll briefly comment and then ask for your input. will faculty promotions happen on a normal schedule this year? One thing that has been raised at other situations is in terms of tenure clocks. I want to emphasize that there is the ability to have extension of tenure clocks if your progress in one way or another is impeded by unforeseen circumstances. And if there ever was an unforeseen circumstance, it's what's going on right now. But Dean Irvin, do you want to just comment on the schedule for faculty promotions and any other messages you want to get to the 188 who are listening right now?
Well, first, I'm going to confirm you're absolutely correct. And you're the person to tell everybody that because you in the end of the day decide that. But we've sent a message to all people that are on the tenure track, letting them know that there is this mechanism to extend and that we view the pandemic as a clearly good case of extraordinary circumstance. Everything's on schedule. We're meeting next week to discuss reappointments. We had 160 that the committee looked at. There's a number of people we think are ready for promotion, and we'll be discussing those. The due date for dossiers for promotion are in the dean's office is still going to be November 1. We'll have to see what the fall brings. We normally get going with meetings of the promotion committee, the faculty standards committee, late November, early December. Much as I, and I'm sure the dean and everybody else would prefer to do that in person, there's no reason why we can't effect a reasonable review using what we're using now, Zoom.
Right.
And I assume that the university's review of our dossiers will be the same. So as far as I know at this point, everything's on track, on schedule.
Great. Thank you very much. We're nearing the end of our hour. And from my standpoint, and all of a sudden, there are always last minute questions. Dean Jensen, can you see the questions of in the queue, and do you mind answering at least the first two, and the third one I'll be reading?
Okay, the first one that I see is, after College of Medicine is reopened, will employees be encouraged to work remotely as able? And we've had this question come before us a number of times, and certainly it is one to be considered by university-wide human resources. Certainly during the transition period, as we're doing phased reopening, those people who can work at home, we would encourage to do so. So, for example, students and faculty who are doing simple computer-based data analysis, writing a paper, working on a grant, sorts of activities that can be done at home, no reason to. In terms of where this is going with staff and our other employees going forward, I want to wait for more formal guidance from human resources to make that decision. But I will certainly say that I am personally supportive of people working at home if they can.
Yeah, and I would amplify that. And
Yep.
We've learned a lot during this. I just heard Facebook is anticipating half of their employees are going to be working from home for the next 5 or 10 years. We're not going that far, but I think we need to look at the lessons we learn. The last two questions, and I'll ask for a rapid fire,
Gotcha.
Gordon, if you don't mind.
Okay.
Is on clinical research.
Right. Next question is clinical research. We have been hard at work on that. There's a whole nother working group that is looking at rolling out clinical research from the medical center and across the network, clinic-based, hospital-based, community-based. It is a work in progress. We do anticipate getting an announcement of where we are now and where we're looking to go, ideally Tuesday or Wednesday of next week. It would be fair to say that safely and appropriately clinical research rollout is going to lag a little bit behind lab rollout, but stay tuned. We're actively working on that. The next question.
It's the same one, pretty much.
Is it the same one? Yeah.
Yep.
Yeah.
Okay, perfect. Thank you.
Yep.
So I'm going to bring us to a close in just a moment. I do really appreciate the engagement, clearly from the questions. Some were anonymous, some weren't. We had students, faculty, staff, many voices. We're trying to be as transparent as possible. We don't always have good news, but we'll give you the news we have. We'll tell you what we know and we'll tell you what we don't know. That all being said, the future is bright no matter what. I'm confident we have the people in place, this leadership team assembled, and Claude Deschamps, unfortunately, was not able to stay with us. But the leadership team we have, I can't imagine a better team. And likewise, the students, faculty, and staff, I've been so impressed at how people have stepped up in this situation. The issue of finances, as was put forward by Dean Cote, they're going to be tough for a while, and we're going to make some sacrifices. From my perspective, our highest priority are our people. And so from when I'm making a tough decision about something we're not going to spend money on, I have to ask myself, is it more important than the people around that we really care about, who are the heart and soul of this College of Medicine? So I'll give up this or that in order to do our best to preserve, whenever possible, the people who make up the College of Medicine. I've been sending out a weekly message for the last 12 weeks. A bit of good news, perhaps, as things are moving a little bit more slowly. So I'm not necessarily going to stay on that schedule, but I will continue to communicate, and we will continue to communicate whenever important news is coming out. We will be doing another town hall by Zoom before we do one in person, I'm absolutely convinced. And the last thing I'll just say is thank you to everybody attending. Thank you for what you do. Please stay well, and I hope you have a great afternoon. Thank you.